sunshine. It's our sunshine.
Hi everyone, I am Dr. Umlaka Reddy. I am a consultant surgical gastroenterologist at Sunshine Hospital, Secunderabad. Today we are going to discuss about the esophageal problems. In esophagus, two important things will be there. One is heartburn, second is dysphagia, means difficulty in swallowing. So today we are going to discuss about the difficulty in swallowing. Usually difficulty in swallowing based on the age and where it is. The esophagus will extend from the lower end of this tongue to the, it will go up to the stomach. It is from the oral cavity, it is 40 centimeters length. From the base of the tongue, it will be around 25 centimeters. So in that, usually the only one organ of the gastrointestinal system which will be there in the chest is esophagus. So that's why they will have pain or difficulty in swallowing in the chest. If it is above, because of few reasons, if it is in the middle, because of few reasons, and if it is low, there will be reasons for that also. So as per age, if they are very small in age, up to 5 to 10 years, means around 10 years, less than 10 years, if somebody is having difficulty in swallowing, that will be because of usually the acid refluxing into the esophagus, which causes the mucosal breaks, ulcerations, and that will go into the stricture, that will cause difficulty in swallowing. Whenever the food, it is like a pipe system. If you're putting something in the pipe, if it is closed in the lower end, obviously it has to dilate proximally, then it will cause pain. The same thing happens in the esophagus. So because of stricture, any closure distal to your passage will cause proximal dilatation and pain. So if it is peptic stricture, usually we'll do endoscopy, we'll see, based on that we'll start the medication. If it is so severe, we have to do endoscopic dilatations, we will open up that stricture. And if somebody is having in the very early, less than 5 years, that may be because of Schatzki's ring, the congenital ring will be there in the lower end of the esophagus. Sometimes some vascular anomalies, blood vessel anomaly that can also cause dysphagia. Based on the condition, we will treat. If it is dysphagia, luceria, we will treat the anomaly of the vessels, and if it is Schatzki's ring, we will do endoscopy and dilatation. Apart from that, few, especially young boys or girls, they will come with some suicide because of corrosive injury. They will take some toilet cleaner for the suicide purpose. In that cases, after taking that, it will burn the mucosa of the whole esophageal tube. That will cause lot of stricturizations everywhere. That will go into, after 3 months, it will go into the complete closure. They will have a lot of dysphagia. In that case, based on the number, based on the stretch, we will go for the dilatation or complete removal of the esophagus. And sometimes what we will do, we'll take out the esophagus, we'll make a conduit of the either stomach or the large intestine. And after this, the other neglected problem is like achalasia cardia. It is a congenital problem. How they will present means more than 6 months of dysphagia, difficulty in swallowing, and the chest pain, and the reflux, and this frequent cough in the night because of refluxing into the lungs, and weight loss. If somebody is having all these problems around 25 to 45 or 50 years, we will go for the endoscopy. We will see why it will happen achalasia. This is because of the sphincter problem at the lower end of the esophagus. It is a congenital problem, so it will go into complete closure state. That's why the proximally it will dilate. The food won't go inside. Initially they can take with the help of water, but after few days they can't even swallow the water also. In that situation, we'll do 3 investigations. One is endoscopy and seeing whether it is going or not. Then we'll do one barium swallow for the shape of the esophagus, and for the third, manometer, how it is functioning, whether the motility, the movement is there in the esophagus or not, we will see. After confirming all this, nowadays the simple thing, laparoscopically we will go and we'll put the camera, we'll do small incisions, we will cut open that muscles, and we'll release the tension on the sphincter. That will be opened up. After surgery, they can take easily food and water without any discomfort. And the last, if somebody is having dysphagia for more than 1 or 2 months with a loss of appetite and weight, if somebody is more than 40 years with smoking history, we have to be very cautious. In that case, there is a chance of cancer is very, very high. So in cancer, more than 40 years or 45 years, they are smokers. If they are smokers with loss of appetite and loss of weight, with significant history of dysphagia, difficulty in swallowing anything, even water, we have to go for the endoscopy. We have to see the cancer, where at which level it is there. We have to take the biopsy. We have to see what type of cancer it is. Then we have to stage the disease by doing CT scan, how it is, whether it is in the only walls of the esophagus, or it has spread to the lymph nodes, or it has spread to the other parts of the body. If it is in first and second stage, usually we will go for the surgery. We will take out the esophagus, we will take out the tube, and we will replace with either stomach or the large intestine. Most of the times replacing with the stomach would be sufficient. And sometimes what will happen, if it is squamous cell carcinoma and if it is stage 3 and stage 4, usually we will go for the chemoradiotherapy. For any cancer, there will be 3 types of treatment. One is to remove the cancer mass, that is surgery, to downstage the tumor, to make it smaller size. Usually we will give radiotherapy, and it also prevents the future recurrence also. And to kill the cancer cells in the blood, usually we will give chemotherapy into the blood. The only drugs we will give into the blood, so they will kill the cancer cells which are unable to see by our eyes. So with these combinations and permutation, so we do treatment for the carcinoma of the esophagus. Nowadays, if you identify early, we can treat aggressively, and the prognosis, I mean future life also will be reasonably good when compared with the other cancers. The important thing to identify early. If somebody is having more than 40 years of age with the difficulty in swallowing, with loss of appetite, loss of weight, immediately they should consult the doctor.
Sunshine, it's our sunshine.